You're welcome. So in this video, now I'm going to be talking about the subjective data. What is objective data? What is subjective data? Subjective data is whatever your patient tells you. I am thirsty, for example. I feel lightheaded. I feel like I want to throw up. I am in pain. Anything reported by your patient is a subjective data. Now, what are the sources of information? Sources of information for subjective data can be the number one source is your patient. It can be the family. It can be healthcare teams. It can be from past medical histories. It can be from labs results. These are all sources of information. What do I mean by that? The patient already verbalized to you that I'm feeling pain. I'm in severe pain. Now, maybe this patient is cognitively impaired. You are asking, what happened? What triggers the pain? How does it happen? And she's not able to remember. The family can say, oh, my mom fell last week. Remember, post neurochecks, post fall. You might fall now and not feel any pain. And in the next 2 to 3 days, you just see bruises everywhere. So that's possible. So in that situation, that's why I said family can also be a source of information. Another one is healthcare professionals. The doctor that has previously worked with this patient, they have some medical histories about this patient that you don't have. They can help giving out that information that, oh yes, Miss Smith was in our hospital 3 months ago, and they have that right to share medical history as long as the patient consented to it. That's why I said healthcare teams can also be a source of information. Their medical records can also help you out. You can obtain their medical records and see what's going on in their life even before now. What are their diagnoses before now? What are they going through medically before now? That's what we discuss when I say medical labs. These are the ways that you can obtain information. From medical labs. So these people I've listed, or these things I've listed, they all can serve as a source of information. All right. Now that we understand that whatever that is being reported is subjective data, what is objective data? Objective data, these are the things that you as a nurse observe. You can easily remember that with objective. Observe. Whatever you can see with your eyes. Now, this patient has walked in with all this pain complaint. I'm not feeling too well. I'm paying too much. I'm using the bathroom too much. And my eyes is blurry. I have dry lips. I have fruity smell. She has come with all of this complaint. Now, as a nurse, you want to start by checking vitals, right? Let me check your vital signs. Let me see what's going on. All those results you got from those vital signs, those are your objective data. That's why I said anything you can measure, they are your objective data. Anything you can see, they are your objective data. Now, another example is, remember I said, if this patient walk up to you in subjective data and report anything, so this patient told you, ma'am, I'm feeling stomach irritation. I feel so nauseated. And right there, she started throwing up. And you observe it as a nurse. That is your objective data because you are going to describe. In the process of assessment, this patient was observed vomiting, having one episode of emesis. You describe what the color is, the texture, and all of that. So, whatever you can measure, whatever you can observe as a nurse, these are your objective data. Now, the technique used in obtaining objective data. What are the techniques? It can be through inspection. If a patient complains of shortness of breath, you're looking at this patient, she cannot even have a full communication with you without gasping for breath, without breathing heavily. You can even hear whistling. Those are your observations. It can be through palpating, when you're palpating this patient. It can be through auscultation. You are listening to their lung sound to know what's actually going on. Another technique can be percussion. It can be either through inspection. You're looking at this patient. She complained of shortness of breath, but while she's in front of you, she's gasping to breathe. You can hear some kind of whistling. You can hear things like that. Another one is palpitation. You see, I told you I have pronunciation problem, right? Palpating their pulse. Another one is percussion. Another one is auscultation. You put in your stethoscope to listen to their long sound. So these are all the techniques you use to obtain your objective data. So thank you. It's a short and quick one, right? Objective data is what you can measure. They are the information you gather yourself in the process of assessment. The question you're asking question, Ma'am, how are you feeling today? What brought you here today? How are you feeling today? I don't think I'm good. I'm not feeling too well. I've been throwing up. I'm thirsty. I've been paying a lot. I'm having slight headache, dry mouth, fruity smell, all those things. And now, oh, when was the last time you had something to eat? Oh, I had burger this morning. Everything they are giving you back as you are questioning them, every of their responses to your question, that is a subjective data. Oh, so what did you drink? When was the last time you had something to drink? Oh, I drank alcohol this morning. I'm alcoholic. I love to drink. I drank water or I had any form of fluid at all. So all those responses, they are your subjective data. Anything they report at all, and anything you observe at all as a nurse, these are all your objective data. So thank you. God bless you. Stay tuned. We're going to cover everything, and I'm going to keep it simple and make it entertaining. I know you love me, and I love you right back. So if you are yet to subscribe, please subscribe. Thank you.